Hello, I'm Rosella Klinger-Bowen. I'm a researcher at the University of Hawaii. I've been working in the aquaculture field as a fish health diagnostic specialist for about 30 years. This presentation, Fish Health Management, Disease Prevention and Diagnosis, is part of the University of Hawaii at Manoa College of Tropical Agriculture and Human Resources Virtual Livestock Industry Field Day Series. This Spentogram depicts how disease occurs. You can apply it to any animal or even plants, but today we use fish as the example. The fish represents the host. Should its environment, the water, become poor quality, or other factors occur such as fish suffer poor nutrition, pathogens can move in and cause disease. The best way to maintain healthy animals is having good husbandry skills, such as keeping good water quality, proper nutrition, and maintaining a well-working system. It is a lot easier to prevent disease than to have to treat the fish. So what would create a conducive environment for pathogens to infect the fish? Poor water quality can occur during any of these four scenarios. Feeding practices. If you see feed left over in the water, you are feeding too much. Not only does this cause poor water quality, you are wasting money. Sanitation. Periodically cleaning filters, backwashing the system, and or siphoning organic material from the tank bottom will go a long way in keeping your fish and the water healthy. Water changes. Not making periodic water exchanges from a reliable water source can alter water chemistry parameters and cause fish to be stressed. Lastly, overtreatments. If fish do get sick, it is important not to treat them without knowing why they are sick. This creates overtreatments which can damage them further and cause poor water quality. There are commercial fish diets out there based on the species and their life stage. Ideally, feed should be kept in a cool, dry area to prevent mold. Temperatures less than 70 degrees Fahrenheit and 50% relative humidity is recommended for feed storage. Store feed in vermin-proof containers such as aluminum or metal cans, elevated on platforms such as pallets. This will discourage rats, mice, and insects and avoid the potential spread of pathogens. Follow feed labels regarding expiration dates. As I said, the cost of overfeeding causes loss of money and poor water quality. Know how much and how often to feed based on the fish's life stage. Sanitation includes each system having dedicated equipment, such as nets, or having a reliable disinfectant for soaking gear between uses. Also, regularly schedule cleaning the biofilter, backflushing, or physical removal of organic material from the tank bottom. Evaporation can occur, so it's important that instead of topping off the tank, you actually do a water exchange, as over time, the tank water chemistries can get very different from the water source. Make sure your water source is dechlorinated or you have a way to dechlorinate it, and it is free of impurities or pathogens. Also, make sure that the source water is roughly the same water chemistry parameters as your tank water, specifically temperature, pH, and dissolved oxygen. There are few select drugs used for fish marketed for human consumption. However, as of yet, there is no regulation for ornamental fish. Take water chemistry before any treatment. Often, a simple flushing with clean water will alleviate the fish's morbidities or mortalities. In the event of a bacterial infection, multiple use treatments can actually mask what is really going on. Whether you work with freshwater or marine fish, the water chemistry parameters you need to measure is relatively the same. Record temperature, dissolved oxygen, and pH daily. Ammonia and nitrites should be measured every couple days in a new system, but after the system is established, they can be measured weekly. Note, the TAN is split into two components, an ionized form, NH4, and unionized form, NH3. The unionized form is what is toxic to fish and is highly dependent on pH and temperature. The higher the temperature and pH are, the more the toxic form will be present. Low amounts of 0.02 parts per million will damage gills and you will see fish getting sick. There are other parameters such as total alkalinity and total hardness that can be measured, and it is dependent on your system as well as the fish species and life stage. There are multiple ways to take water chemistry, from test strips to meters. A fish farming water test kit, seen at the top left, measures up to 9 different parameters. There are also meters, seen here at the top right, which are very accurate but can get expensive, and it needs careful handling as well as periodic calibration. What you choose to use depends on how many systems that you have, what you want to spend, and how accurate you need to be. No matter if you have a home fish tank or pond, an aquaponic system, or raising fish for aquaculture, it is important to keep good records. This includes when you brought the fish in, how many and at what size, where you got new fish or fish stocks, or if you added new fish to an established system. Keep notes of what you feed and how much. Record the water chemistries when you take them. Write down when and how much you made routine water exchanges or cleaned the filters. Lastly, note any differentiations between an individual fish looking sick to the whole population. Bottom line, know your fish. Where do they occur in nature? Fast-moving streams, deep ocean water, or lakes? What do they eat in the wild? Can they be trained on pelleted feeds needed for raising aquaculture species, or do they need live feeds? Know their optimal temperature for growth and overall health. Do they like to school, or are they more solitary and/or aggressive towards other species? You should always observe your fish every day, throughout the day. Are they eating well? Is their behavior normal? How do they look? Because dying and dead fish often means it is too late. Watching your fish daily and keeping good records will go a long way to preventing what is happening in this picture. So how do you determine if your fish are sick? Let's look first at feeding activity. Are they eating aggressively? The general rule of thumb is feed should be gone within 5 minutes. Note that there may be seasonal changes when fish slow in feeding habits. For example, tilapia in Hawaii may eat less during the cooler winter months or during reproduction. Remember, make sure feed is stored properly and used within the expiration date. You may need to check for mold. How are the fish acting? Are they moving slower than normal? Being lethargic? Are they oriented differently? Lying on their side, for instance? Are they at the surface gasping or gathered near an incoming water source? Do they rub against the bottom or are they erratically swimming? All these signs are telling you something is wrong. Look at the fish closely. Do you see any lesions or sores on their body or head? Are their fins frayed or reddened? Look for abnormal body parts, such as a swollen belly, cloudy or popped eyes. Are there any spots or growths on the body, fins, or gills? Disease can be categorized in 2 ways. Infectious, meaning it can be passed animal to animal, can be caused by parasites, bacteria, viruses, or fungi. These typically require treatment. Non-infectious is not transferred fish to fish, but it can affect the whole population. These are poor environmental issues, poor nutrition, or genetic disorders. Non-infectious diseases generally require a change in husbandry management. A good tool to use is tracking the time from when a fish appears sick to when and how many mortalities occur. By creating a graph with percent mortalities on the y-axis and time on the bottom axis, you can pinpoint possibly what is going on. For example, if all your fish died within 24 hours, this is called peracute mortality. Usually that is a water quality issue, such as low dissolved oxygen or chlorine toxicity. Acute mortalities are when fish die more and more steadily and increasing over days to weeks. This may be an environmental issue, such as toxic ammonia, but most likely is from a parasitic or a bacterial cause. If you have fish dying here and there over weeks or months, this is a chronic curve. This can be caused by husbandry, such as poor nutrition, or from bacterial infections. This pie chart is a synopsis of the cases I diagnosed in the last 25 years. As you can see, the majority of cases were caused by a water quality issue. About 10% were fish infected by parasites, and about 5% of the cases were caused by bacterial infections. If you have history records of your system, water chemistries, and the fish, you will know to look for the first signs of illness. Should fish go off feed, develop abnormal swimming behaviors, or appear with sores, frayed fins, or growths, immediately take all the water chemistry parameters. If any of the water chemistry parameters have changed from previous records, a water exchange might be all you need for the fish to resume normal behavior. If the water tests have not changed, you will need to take a closer look examining the fish. This is particularly true if you recently added new fish to an established system without quarantine. It's possible the new fish are carriers of a parasite, bacteria, or virus. Having a good sample is imperative to getting accurate results. The best sample is a dying fish, one that shows symptoms and probably won't survive the night. In aquaculture, generally examining 3 to 5 fish in a population is needed. However, if you have valuable animals, such as broodstock, or you have fish as pets, that is not practical. The fish health professional will then do a live examination. A fish dead less than 6 hours old may be useful if removed immediately and wrapped and kept cold in the refrigerator. A frozen sample does not work, especially if we suspect parasites. I've written an extension paper on what makes a good fish sample for diagnosis. The link is listed below. A word about obligate versus opportunistic pathogens. Obligate pathogens require an animal host to live, while opportunistic pathogens do not. Opportunistic pathogens occur naturally in the environment, living in the organic matter. When the fish is compromised, such as poor water quality, these pathogens will attack the fish and cause further damage and mortality. Although ornamental fish do not have regulation on medications compared to drugs used for aquaculture species, it is important to manage your system well, have good husbandry skills, and ideal water quality. With these tactics, you will avoid any pathogens entering your system and possibly requiring treatment. Thank you for listening today.